ahead and wash my hands before I conduct the examination. I do have my patient here. Can you please provide me with
Cynthia Adras?
Okay, and is it okay if I call you Miss Adras during the exam?
Yes.
Okay. So I'm just going to go ahead and introduce myself. My name is Cassandra. I will be the nurse practitioner that's conducting your examination today. The purpose for this examination, we're going to go through different systems, different organs. We're going to go ahead and assess to make sure everything is within normal. I do notice that Miss Adras is here. She seems very pleasant. She answers questions appropriately. She does not appear to be in any distress, any illness. So we're going to go ahead and provide some privacy, okay? Just for the sake of your comfort and, just to limit any exposure. Now, Miss Adras, I do have a drape here off to the side. We'll use it a little bit later once we get to a certain part of the examination, but it is there for you to provide comfort, okay? We're going to go ahead and first assess your vitals. So I will go ahead and ask you to extend your arm. Perfect. You can have it right here. I'm actually going to first locate the brachial artery. Now, I am going to use my stethoscope so I can also auscultate. Is that okay? Okay, so for the radial artery, we usually go ahead and assess for about 15 seconds. I'm also going to count your respiration rate for about 30 seconds. Vitals have been obtained. Now, Ms. Adras, we're going to go ahead and move on to the head portion of the examination, okay? I'm just first going to inspect your head. I notice that everything seems to be intact. Notice any visible wounds. If you can, I'm just going to go ahead and inspect. Now, I am going to part your hair in 3 locations. I notice I didn't inspect your face. I do notice that both sides are symmetrical, free from any. Okay, so I am going to go ahead and palpate your temporal artery. Perfect. I do notice that it's present, it's bounding. While I'm here, I'm also going to go ahead and palpate your temporal mandibular joint. So I am going to place my fingers before your tragus. And what I'm going to ask you to do is open and close your mouth. So temporal mandibular joint has been assessed. I don't notice any clicking. There's actually a very smooth. Go ahead and inspect the external canal. I notice that it's clear. It's inspect the internal, your eardrum, and the middle ear canal, okay? So for this, I am going to use my otoscope. I'm actually going to pull your ear up and back to straighten out the canal. Perfect. I'm going to do the same thing to this side. I'm going to pull your ear up and back just to straighten out the canal. Perfect. Now, Miss Adras, I'm going to step about 2 feet away. We're going to go ahead and do something that we call the whisper test. This is just for me to assess your hearing, to see if I notice any deviation from one ear versus the other, okay? Can you repeat those 3 words?
Cat, dog, mice.
Perfect. So now I'm going to ask you to do the same thing. You're going to occlude your right ear. We're going to test your left ear. Can you repeat those 3 words?
In, out, open.
Perfect. So now, Miss Adras, I do notice that you do have symmetrical hearing in both ears. We're going to go ahead and do another examination for the ears, which is called the Weber test. So we're actually going to test your air bone conduction. So doing this, I'll have an instrument. I'm actually going to put it on the top of your head. You're going to let me know if you feel or hear the vibration, I should say, in both ears, if you hear it only in your right ear, or if you only hear it in your left ear, okay? So,
Both ears.
Fine test. Now this test, I'm actually going to put the instrument on your mastoid bone. Now what I want you to do is let me know when you first hear the sound, when you stop hearing the sound, which is like a vibration. Once you stop, I'll go ahead and move it in front of your ear canal, and you'll let me know as well when you stop hearing the vibration, okay? All right, so we're going to first go ahead and test your left ear. I'm here on the mastoid bone. Yes. Let me know when it stops. Stop, okay? It's in front of your ear now. Tell me when it stops. Stop. Perfect. So we're going to go ahead and do the same thing in your right ear, okay? My instrument is here on the mastoid bone. Let me know when it stops. Stop. Okay? In front of your ear canal. Let me know when it stops. Perfect. Okay, so that conducts the ear portion of the exam. We're going to move right along into the eye portion. So right now where I have you seated, Miss Adras, you're actually about 20 feet away from the Snellen chart that I have above. What you do is occlude one eye with the place card that I have here, and you're going to go ahead and read that first line for me.
M-I-A-H-I-O.
Perfect. So now what I'm going to go ahead, you're going to go ahead and do the same thing. You're going to occlude the left eye, and you're going to repeat line 5 for me here.
S-A-R-A-I.
Perfect. Thank you, Ms. A. I'm going to go ahead and put the place card here. So now what we're going to do, a test that's called your visual field of confrontation. So with this, I'm just going to stand about 2 feet away. Now, what I want you to do is look at me directly into my eyes. Now, I'm going to ask you to go ahead and cover your right eye. I'm going to go ahead and cover my left eye. Now, what I want you to do is try to look into different fields of your vision, and you're going to let me know how many fingers you see within each corner, okay? And then afterwards, we'll go ahead and alternate. So I'm covering my right eye. Just let me know when my fingers are outside of your view. Okay. Can you let me know how many fingers you see here?
2,
Okay. What about here?
1,
Okay. What about here? Look directly at me.
2,
Okay. And what about here?
1.
Perfect. So we're going to go ahead and switch. You're going to occlude your left eye, and I'll occlude my right eye. Okay? Same concept. Let me know how many fingers you see here.
1,
Okay. How many you see here?
2,
Here. Look directly at me.
2,
Okay. And what about up here?
1.
Perfect. Just to go ahead and inspect your eyes alone, just to check the size, the color, the shape, the alignment. I do notice that it's symmetrical. The color seems to be clear. I don't notice any visible drainage or any irritation at all. So what I am going to ask you to do is go ahead and look up for me. I'm going to use my fingers to pull down on your lower lids. Perfect. So the reason for that is just to go ahead and check the inferior sclera, just to make sure everything is intact. I am going to go ahead and inspect the size. So for this, I am going to use my pen light. Okay, and also I just want to check the color of your iris. Perfect. Now I am going to shine the pen light, and this is going to help me to conduct the size of your pupils and also to make sure that everything constricts as they should. Now to do this, I am going to bring this into your vision. But first, I want you to go ahead and look off into the distance because I don't want you to fixate on the actual light. Okay? So here we go. I'm going to check your left eye. Perfect. I'm checking your right eye. Perfect. So I do notice that your pupils dilate, and then they did constrict when I did use the pen head and test for the extraocular motor exam. This is helping us to basically assess the 6 cardinal directional gaze. So to do this, I'm going to check your visual fields in different directions. Now all I want you to do is go ahead and follow my finger. First, I want you to look directly. Here we go. Perfect. Now I'm also going to go ahead and check for the accommodation in both eyes. Here we go. Perfect. So I do notice your eyes accommodated. I do notice a conversion, so that's a good thing. So Ms. Adras, that completes the eye portion of the examination. We're going to go right ahead into the nose, okay? So I'm just going to go ahead and inspect your nose, both anterior. I'm also going to do your inferior nose. I have my otoscope here with me. This is just going to help to give me a wider view. I'm going to go ahead and protrude it just very lightly in both nostrils. Perfect. So I do notice your nose to be midline. I do see that it's symmetrical on both sides with your nose. So I am going to use my pen light. Again, I'm just going to go in very slightly, and this should just give me a clearer view of the nasal vestibule, okay? Perfect. I'm going to use my otoscope. I'm going to tilt your head back just very slightly. This is going to help me to notice the nasal cavity, and I just want to make sure that everything's clear, it's intact. So I am going to tilt your head back just a little bit. Okay, I'm just going to slightly insert my otoscope. Perfect. We're going to go ahead and move along to the mouth portion, okay? Before I do anything, I'm just going to notice your mouth. I do see that your lips are intact. They're midline. They're symmetrical. Any cuts, any bruises, or anything. I am going to ask you to open your mouth. I'm going to use my tongue blade and my light, and I'm just going to go ahead and inspect your soft and hard palate. Perfect. I'm just going to take a look at your gums. Open your mouth one more time, and you're going to say, ah, ah. Perfect. Now, I'm going to ask you to do it one more time. Just extend your tongue just a little bit. I want to take a better look at your tonsil. Say, ah, ah. Perfect. Now, so before moving on to the next organ, I am going to ask you to open your mouth again. I just want to go ahead and inspect your buccal mucosa. So I'm going to look on the inside of your cheeks. And I also want to give the gingiva another look, okay? Perfect. I'm going to go ahead on this side. Nice. So I do notice that everything's intact. Findings appears to be within normal range. So we're going to go ahead now and move on to the neck portion of the examination, okay? Sorry, as I excuse my hair. So I'm just going to go ahead and inspect your neck. I'm going to move over here. And I'm also going to look on this side. So I do notice that your neck is intact. Color is distributed fairly. There's no discoloration. Now we're going to go ahead and palpate your lymph nodes. So here I'm going to palpate a few lymph nodes. I'm going to go ahead and palpate your auricular, your posterior auricular, your submental, and your supraclavicular lymph nodes, okay? Here I'm just testing to see if I feel anything inflamed. Sorry. Now we're going to go ahead, before moving to the trachea, I just want to go ahead and do one other examination with your eyes. So basically I'm going to darken the room, okay? And I'm going to use my ophthalmoscope. I'm going to use it in my right hand, and I'm also going to look into your right eye, okay? And then we'll alternate. Perfect. I'm going to go ahead now and look into the left eye. Perfect. So basically, I notice an orange glow. I do notice a red reflex from your retina, and I don't notice anything interrupting that red reflex, which is within 5 minutes. So moving along, we're going to go ahead and inspect your trachea. So I do notice that your neck is symmetrical, it's midline. I don't notice any deviation. I'm going to go ahead and palpate. I have my fingers on the side, and I'm just checking for the space between your sternocleidomastoid. Perfect. So I do notice that your trachea is midline, and we're going to go ahead and inspect the thyroid. So I'm standing here in front of you. I'm just going to visually look at the throat area. I do want you to go ahead and tilt your head back. I am going to go ahead and locate the cricoid cartilage. I'm just going to place my fingers a little bit before just to palpate the thyroid. I am going to use both hands to go ahead and palpate. Now what I am going to ask you to do is go ahead and swallow. Perfect. Okay. Now what I'm going to do, I'm just going to see if you can flex your neck forward. I'm also going to try this from the back. And go ahead and swallow for me. Perfect. Okay, so that's just us going ahead and palpating your thyroid. I wanted to do it both visually and also while swallowing. So while we're here, I'm also going to go ahead and do your thoracic exam. So this is just going to help me monitor your respirations and to see how well you're breathing and your lung functioning, okay? So I'm just going to visually inspect the chest area. I do notice that it rises and falls symmetrically. I don't notice that you're in any distress. You're not using any accessory muscles, which is a good thing. I'm going to go ahead and calculate your respiration rate for a full minute. Okay, so I do note that your respiration rate is 18 per minute. I do notice that your rhythm is regular, no distress noted. I'm going to have a look at your nails. Okay, I don't notice any clubbing, and you don't appear to have any cyanotic symptoms. I don't notice any discoloration around your mouth or anything to let me believe that you're having a difficulty with breathing, okay? So now that we've done the inspection and the respiration rate, I'm going to go ahead and check for the symmetry of your chest expansion. So I'm going to do this both anteriorly and posteriorly, okay? Now what I'm going to ask you to do is go ahead and take a nice deep breath in and exhale. Exhale, perfect. I'm going to do it again down here, one more. Perfect. I do notice the rise and fall symmetrically. I'm just going to come here behind you and we're going to do the same thing posteriorly. Inhale. Perfect. Exhale. Again, inhale. Exhale. One more time. Inhale. Exhale. Perfect. So I do notice a symmetrical rise and fall for the chest expansion. Now what we're going to go ahead and do is check for the firmness among all of the lung fields. So what I am going to ask you to do is just to say 99 when I palpate your lung fields, okay? I'll walk you through it. Go ahead.
99, 99, 99, 99, 99, 99, 99.
I'm going to do the same thing posteriorly, okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So I did use the palm of my hand to go ahead and check the firmness, and I do notice the vibrations within all lung fields. So now we're going to go ahead and I'm going to percuss to compare the left and right chest wall, and we're going to do this to identify any discrepancies, if you have any trouble breathing, and I just want to see if I hear any noise changes from a dull to a symphonic. So we'll go ahead and do that now. Okay. I'm also going to do this on the posterior. Just going to go ahead and listen to all lung fields. Just go ahead and inhale and exhale quietly, mind slightly open, okay? I'm going to go ahead and do the same thing posteriorly, okay? Inhale. Exhale. Inhale. Exhale. Perfect. Now I did go ahead and auscultate your lung fields for about a minute for each breath on inspiration and expiration. Okay? So that completes the thoracic exam. We're going to move directly over to the breast portion. Now for the sake of this video, we're going to go ahead and do everything as if we were doing it in the examination room, but with our clothes on. Okay? So first what I'll do is just visually assess the breasts. I do notice that they are midline to the body. They do seem to be symmetrical. I don't notice any scarring, any open wounds. Now what I am going to ask you to do, Miss Adras, is to go ahead and raise your arms above your head, on your head. Perfect. And then what I'm going to ask you to do now is go ahead and place your arms on your waist and flex slightly forward. Perfect. Now I don't notice any discharge. I don't notice any dimpling. Everything seems to be intact. So we'll go ahead and continue with the examination. Okay? I do notice that the size, shape, and contour of the breast seems all to be within normal findings. I don't notice any discrepancies. Okay? Now we're going to go ahead and move on towards the cardiac portion of the examination. First, what I'll do is go ahead and just visually inspect. I do notice the chest wall is symmetrical. It's intact. You don't seem diaphoretic. You don't seem to have any palpitations or anything of that sort. What I am going to do is go ahead and assess for your carotid artery. Now, I'm going to do it one side at a time. When I do your right side, I do want you to go ahead and look towards your left. Vice versa, when I check your right carotid, I want you to look towards your left and your right towards your right. So we're going to start off with your left. You're going to look towards your right. Flex your head more to the right. Perfect. I'm going to go ahead and check your right. Perfect. Now, usually when we're doing this portion of the examination, you will be laying down supine with the head of the bed slightly raised about 30 to 45 degrees. Okay? Perfect. So now what we're going to do, I'm sorry, I did notice the carotid arteries are bounding, they are present, and they are equal on both sides. So we are going to go ahead and auscultate the carotids. Now I'm just looking for any murmurs, any bruits, of anything of that sort. So I am going to use my stethoscope. Okay. And again. I'm also going to assess with the bell. Perfect. And again, I'm assessing with the bell portion of my stethoscope. Perfect. Now, while I'm here, Miss Adras, we're going to also go ahead and palpate your apical post, which is located at the 5th intercostal space, mid-clavicular line. Here, just slightly backwards. I am going to auscultate your heart sounds. Now, there are specific heart sounds that I do want to listen to. While you're here laying at about 30 to 45 degrees, I'm going to go ahead and auscultate your second right intercostal space, also your second left sternal border, and the apex. Okay? So you can stay the way you are. You're at 30 to 45 degrees. There we go. Perfect. Now, what I am going to do, just to double check, I am going to go ahead and use the bell portion of my stethoscope, and I'm just assessing for any murmurs or any bruits or any abnormalities that we could find, okay? Perfect. So heart sounds are within normal findings. I don't notice any third or any additional heart sounds. No. We will begin with the abdomen portion of the examination. For the sake of the exam, we'll act as if you are laying down flat, belly is exposed. First, I will go ahead and inspect the area. I don't notice any discoloration. The color seems to be fair. I don't notice any open wounds, any lumps, or anything of that sort. Everything seems to be intact. Now I will go ahead and auscultate all 4 quadrants as well as the epigastric location. Okay. We're going to start here in the lower left quadrant. Right upper, left upper quadrant, left lower quadrant, epigastric location. Perfect. Now I do notice a high-pitched rumbling sound, which lets me know that you do have present bowel sounds within all four quadrants, okay? Now I am going to state that I do notice a pulsation in the upper abdomen, which is linked with the aortic. Now, Ms. Adras, we're going to move on with the percussion portion of the examination of the abdomen. Now I am going to percuss over two main fields, over your liver as well as your spleen. We'll start off with your liver, which is located on your right side. Let me know if you feel any tenderness, any pain during the percussion, okay? Okay, I'm going to move over here for the spleen. Perfect. Did you notice any tenderness or any pain at all? Perfect. Okay, so now we're going to move on with the Rosen sign. Basically, I'm going to go ahead and press deep into the lower left quadrant. Now, when I release, just let me know if you feel any pain at the site or any other quadrants, okay? Any pain or tenderness? No. Now, I am also going to check for the rebound tenderness. This is mostly linked with the liver, so I'm going to go back here on your right side. Any pain, any tenderness? Okay, Ms. Adras, so before moving further, we're going to go back. I just need to go ahead and auscultate your renal arteries as well as the aorta. So we'll do that now. Renal arteries and aorta. Perfect. Now, just to state for the sake of the exam, when we did go ahead and check for any rebound tenderness, I did go ahead and palpate at the base of the liver. No rebound tenderness was noted. Go ahead now and conduct the palpation portion of the examination for your abdomen. I'm also going to be doing light and deep palpation. We'll start off with light. I'll go through all four quadrants and then we'll go ahead with the deep palpation. Now, here I am checking for any mass, any tenderness locations. If you have any pain at any point of the examination, just let me know. So we're going to go here and start off with the right lower quadrant. Moving along to the right upper quadrant, left upper quadrant, left lower quadrant. Okay. Do you notice any pain, any tenderness? Perfect. And I do not notice any mass or any enlargement at all. So now we're going to go ahead and move along with the Rossman sign. I'm going to go ahead and push into your left lower quadrant. If you feel any pain or tenderness at that location or any other quadrant, you let me know. Perfect. Okay, so now we're going to move along with the Pulses sign. Now I am going to ask you to lay down to the best of your comfort. Perfect. So I'm just going to go ahead and place my hand over your knee. And I'm just raising your thigh. Now I want you to go ahead and raise your thigh against my hand. Perfect. We're going to go ahead and conduct this in the opposite leg. Perfect. Okay, you can do the arbitrary sign. So I'm going to ask you again to lay down. Now what we are going to do is flex your right thigh. Okay? I'm sorry, we're going to flex your right leg towards your thigh. Now I'm just going to go ahead and rotate internally. Any pain? Okay, and I do not notice any clicking. We'll do the same thing for your left leg. I'm just going to go ahead and flex it up towards your thigh, and I'm going to rotate internally. Any pain? And I do not notice any clicking. Range of motion is nice and smooth. Okay, you may up. You can actually stay just like this, because while you're here, I'm going to actually go ahead and palpate and percuss for your kidneys, just to see if I notice any tenderness at all. So we're going to go here. And I'm also going to do the same thing anteriorly. Going to percuss. Any pain, any tenderness during palpation or percussion? Perfect. And I do not notice any enlargement, and as my patient stated, there's no pain or tenderness. Okay? You may turn it on. Perfect. Now what I do want to do is go ahead and inspect and palpate your postal margin. I'm going to ask you to take a nice deep breath in and out. I'm going to perform this both anteriorly and posteriorly, and just let me know if you feel any pain or tenderness, okay? Okay. We're going to try this again posteriorly. Go ahead. Any pain, any tenderness? Grab your hands. Okay, I don't notice any enlargement. I don't notice any swelling. I'm going to just turn them over. Hand seems to be intact. There's no visible cuts or wounds. Perfect. So now we're going to go ahead and I'm going to palpate your wrist. Okay? And I'm just palpating for any carpal joints. I'm noticing to see if I see any abnormalities, any swelling in your joints, which I don't. Perfect. So we're going to go ahead and perform the Teno sign, which I'm just going to tap over your medial nerve. Just let me know if you feel any pain or tenderness. Okay. So I am going to try now with the carpal compression test. I'm going to do the same thing, but I am going to compress the medial nerve with both thumbs. Do you feel any pain, any tenderness? So no pain, no tenderness noted. We're going to go ahead now and do the Fallon test. I'm going to ask you to bring both hands to a 90-degree angle. Now you're going to perform this for about 40 to 60 seconds, and you'll let me know if you feel any tingling, any pain. Okay, so now it's been 60 seconds. Do you feel any tingling? Perfect, okay. So another thing that we want to go ahead and assess for Ms. Adras is your range of motion. So for this, we're going to assess both your wrists, we're going to assess your shoulders, your hips, as well as your elbows. So there's about 4 steps that I will walk you through doing: flexion, extension, abduct, and adduction, okay? So I'm going to start off with your wrist. I'm going to ask you to go ahead and flex and extend, and also adduct and adduct. Perfect. We're going to do the same thing now with the shoulders. I just want you to go ahead and raise and perfect, and just go ahead and adduct and adduct. Perfect. Now with the elbows, go ahead and flex, extend the arms, adduct and adduct. Perfect. Now for your hip portion, we're going to go ahead and just lay down. Now I'm going to you can lay down first. We're just going to go ahead first and just place your hands underneath to the best of your abilities. And you're just going to go ahead and raise. Perfect. And then I'm going to ask you to adduct, and then adduct. Bring perfect. Okay, you may raise up. Perfect. Did you feel any pain, any tenderness, or anything at all when you were going through these motions? No. Okay. So now what we'll do then is go ahead and test the range of motion with your shoulders. I'm going to ask you to go ahead and raise your shoulders. Perfect. Go ahead and put it down. Now I'm going to ask you to go ahead and place your arms above your head, behind your neck, and just reach towards the small of your upper back. Awesome. Go ahead and put your arms back down for me. Now we're going to do the same motion, but starting from the base of your back. So go ahead and place your arms behind your back. Now what I do want you to do is try to slide up to as far up as you can. Slide slowly. Perfect. And I do notice that you're reached to a level about T7. Awesome. Okay, you can go ahead and put it back down. So now we're going to go ahead and test for the RC testing, which is also called the empty can testing. So what I am going to ask you to do is go ahead and abduct your arms to about 30 degrees. Now you're going to go ahead and fully turn internal. So your thumb should be facing the floor. And I'm going to ask you to go ahead and flex your shoulders forward. Now, do you notice any pain, any resistance, any tenderness? Perfect. So no pain, tenderness, or resistance is noticed for the empty can test. Awesome. To go ahead and assess for the nearest test for impingement. So basically, I'm going to ask you to go ahead and raise your right arm, or your left, right arm. You're going to extend that above your neck. You're going to grab your other arm. You're going to go ahead and grab your elbow and pull down slightly. And I'm just checking to see if you notice any pain or tenderness. Perfect. So we're going to go ahead and alternate. Perfect. Any pain, any tenderness? Good. Okay. So now we're going to go ahead and I want to assess your cervical spine. So I am going to ask you to stand up. I want your back to be facing me. Now first I'm going to go ahead and visually inspect the spine. I don't notice any curvature, no scoliosis, no kyphosis, or lordosis. It's actually straightened out. Perfect. I am going to go ahead and palpate over your spinal. Any tenderness at all when I'm palpating?
No.
Perfect. You may have a seat. Okay, Ms. Adras, so that did complete the cervical portion of the examination, but now what I do want to go ahead is assess your range of motion within your neck. So I am going to ask you to go ahead and look up for me, look down, so that was the flexion and extending. I am going to ask you to go ahead and bring your head side to side, and then we're going to rotate your head from left to right. Perfect. Any tenderness, any pain at all? Awesome. So that did complete the range of motion portion of the neck. Okay? Okay, Ms. Adras, so now we're going to go ahead and conduct the knees portion of the examination. So while we're here, I'm just going to first inspect the knees. Now I don't notice any swelling or any abnormalities. I'm just going to go ahead and palpate. Okay, now we will go ahead and conduct a further examination, which is going to be to check for any effusion and ballottement tests. So I'm just going to ask you to go ahead and flex the knee. Flex. Okay. I'm going to go ahead and place my hand on the patellar. And I'm just going to go ahead and locate a little bit down, and I don't notice any extra fluid. I'm going to go ahead and do the same thing for the left knee, okay? So I'm just going to go ahead and I'm going to place my hand on the suprapatellar, and I'm just going to push down. Perfect. So I don't notice any extra fluid, no swelling or anything of that sort. So now we're going to go ahead and conduct the neck morae test, which is the medial meniscus. So I'm going to place my fingers on the medial line. Okay, I'm going to ask you to go ahead and flex and extend. I'm going to go ahead and rotate your ankle outward and inward. Perfect. I'm going to do the same thing for your left leg. So again, I'm going to go ahead and place my hand here. Flex. And I'm rotating the ankles. Perfect. Now I don't notice any clicking. I don't notice any limitations while I was conducting the neck morae test. So we're just going to go ahead and move on with the aptly grind test. Okay? So for the aptly grind test, I am going to go ahead and ask you to lay on your stomach to the best that you can for the sake of the examination. On your stomach. Perfect. Now I am going to go ahead and grasp your ankle. Now I am going to flex upward with my leg on your thigh. Now I'm just checking to see if I notice any tenderness, any limitations, okay? Perfect. I'm going to go ahead and conduct the same thing with the opposite leg. Perfect. No limitations noted, no tenderness, and no pain upon the examination. You can go ahead and sit up for me. Okay, so now we're going to go ahead and test for the ACL test, okay? Okay, Ms. Adras, so we're now going to go ahead and conduct the ACL portion of the examination. So I am going to ask you to lay down to the best of your comfort.
On my stomach?
On your back. So this test, I'm going to go ahead and stabilize the femur. I'm just going to raise anteriorly and posteriorly. And I do notice a smooth transition. I don't notice any clicking or any limitations. I am going to go ahead and do the same thing with the right side. Stabilizing. And I'm just flexing and extending anteriorly. Okay, perfect. You may sit up. Thank you for that. Did you notice any pain at all or any tenderness during the motion? Perfect. Okay, Ms. Adras, so we're going to go ahead and assess your hips. So I'm going to ask you to go ahead and flex internal and external using your legs. Perfect. And then, awesome. Okay, so now we are going to go ahead and perform the Thomas test. So I will ask you to place your hands underneath like your spinal area. You're going to bring one leg up into your chest while leaving the other one flat. Perfect. And go ahead and do that with the next leg. Perfect. So I don't notice your opposite thigh raising. It remains in a neutral position, which is a good sign. Go ahead and sit up for me. Now, I know you provided this earlier, but can you please tell me your first and last name?
Cynthia Adras.
And date of birth?
10/13/87.
And do you know where you are right now?
Yes, the clinic.
Okay, and can you provide me the year?
2020.
Okay, so you are alert and oriented, time 4. That's for cranial nerve number 5, which is your trigeminal. I am going to go ahead and palpate your temporal again. I'm going to ask you to go ahead and clench your teeth. Perfect, release. Awesome. Now, another thing that I am going to do is go ahead and check for different sensations. So I am going to provide pain and a light touch. So I'm just going to go ahead and do this on your cheeks, your forehead, your jaw. Just let me know if you feel my touch. Now, do you feel it as soft or pain?
Soft.
Okay. What about now?
Soft.
Perfect. Okay. So now we're going to go ahead and assess for cranial nerve number 7. So for this is the facial. So I am going to ask you to go ahead and raise your eyebrows, smile, make a frown, tightly shut your eyes, stick your tongue out inside your mouth through each cheek, and show all of your teeth, upper and lower. Perfect. So we did go ahead and assess cranial nerve number 7. Now we're okay, Ms. Adras, so we're going to go ahead and assess for cranial nerve number 10, which is your vagus. I am going to ask you to open and say ah. Perfect. So I do notice your soft palate along with your pharynx. I am also going to go ahead and check your gag reflex with a tongue blade. For the sake of the video, we're just going to walk through the motion. Open up. Perfect. I do notice that your gag reflex is present. Okay. So now, Ms. Adras, we're going to go ahead and assess for cranial nerve number 11, which is your accessory. I just want to test your resistance. When I go ahead and place my hands on your shoulders, just go ahead and shrug your shoulders for me. Perfect. And do it on your own. Perfect. So I do notice that your cranial nerve number 11 is intact. You shrug it symmetrically. I am going to go ahead and check for cranial nerve number 12, which is your hypoglossal. So this one, I am going to ask you to stick out your tongue. Go ahead. Perfect. Now go ahead and stick your tongue out inside both cheeks. Perfect. So I do notice that your hypoglossal nerve is intact. We're also going to go ahead and monitor your gait. So for this, I just want you to go ahead and just stand up. Just walk towards the camera and just walk right back through. Perfect. Perfect. Now, another thing that I do want to go ahead and test is your finger to nose. So you're going to go ahead and extend your arm to your nose. Perfect. And do it with the opposite arm. Perfect. So I do notice that you're able to do it bilaterally. Now I am going to go ahead and check the strength of your shoulders for your abduction. So you're going to go ahead and act as if you're trying to open up your arms for me. Perfect. Again. Awesome. So I do notice that you do have your strength, bilateral arms. I don't notice any deficits. We are going to also go ahead and do your elbow flexion and extension. So what you're going to do is just simply open and close. Perfect. Awesome. And I do notice that you have a smooth transition. I don't notice any resistance on your end. Now another thing that we're going to do is the extension and flexion of your wrist. So the same concept. Perfect. Awesome. Do you have any pain? And I also do not notice any clicking at all when you're performing the movement. We are going to go ahead and do your finger flexion. So basically, you're going to move your fingers in different directions, up and down. Perfect. You're also going to go ahead and do a clacking. Perfect. And I do notice that it's symmetrical within both hands. Thank you for that. Another thing that we're going to go ahead and check for is your hand eccentrics, which is pretty much the same thing that we just did, but you're going to go ahead and open and close your hands. You're going to point with your fingers. Hands. Awesome. And I don't notice any discrepancy, so everything seems to be intact with your hands. Okay? Moving right along, we're just going to go ahead and do the round word test. I'm going to ask you to go ahead and stand up for me. I just want to go ahead and check your balance. Now, just standing with both hands at your side, I don't notice any swaying, any movements. I am going to ask you to go ahead and close your eyes. Perfect. And I am noticing for the sake of the examination that your feet are together, your hands are at your sides, and I don't notice any swaying. Go ahead and put your hands out for me in the same position. And I'm just monitoring, feet together, hands out in front. There's no swaying and there's no movement. Perfect. You may have a seat. Do the reflex portion of the examination. So I do have here my reflex hammer. I'm going to go ahead and assess for your bicep, tricep, and your patellar. Okay. Since you're sitting down, we'll go ahead and start off with the patellar. Go ahead and uncross your legs for me. I'm going to go ahead and check your left. Perfect. Your right. Patellar. You're going to move up here to your biceps. Perfect. And your triceps. We're going to go ahead and test for your sensory skills. We're going to start off by doing a skill called stereognosis. I'm going to place an object in your palm. Now I do want you to close your eyes and identify the object for me, okay?
A coin.
Okay, perfect. So we do notice that is intact. I'm also going to go ahead and do another skill with your sensory, which is called graphesthesia, where I'm going to write a number or a letter in the palm. You go ahead and then identify that for me, okay?
8.
Okay?
B.
Perfect. So I do notice that's intact. Moving right along, I just want to go ahead and inspect your lower extremities. Now what I'm looking for is any swelling, any edema, if I notice any skin breakdown or anything out of the ordinary. So I am going to go here. I'm assessing both legs, lower extremities. I'm palpating. I don't notice any swelling. I'm going to go ahead and check your pulses here. Okay, Ms. Adras, so we did go ahead and palpate your lower extremity pulses. We went ahead and palpated your dorsalis pedis, your posterior tibia, and also your arterial pulse. Now, I do notice that all pulses are +2. They are present and bounding. So this does complete the examination. I want to thank you for your time.
Thank you.
You're welcome.
Bye.